Hi, Dr. Coleman here, Coleman Center for Cosmetic Dentistry, with this week's version of Dental Health with Dr. C. I have a true confession. We actually taped this thing about a month ago, and Phil, my producer and executive chef, had a really good idea, but in all honesty, we just couldn't do it. I actually started the segment with my shirt off, because we're going to talk about missing things and how distracting they can be. And after I saw it, I realized I had to lose about 10 pounds and get my shoulders waxed. So we decided to refilm this thing today. What I want to talk about is missing things, like missing teeth. You know, if you're missing a front tooth or a tooth you can see kind of from the side, you know what people think when they look at you? Damn, that man's missing a tooth. And you know what? It's really distracting. I mean, if you're in a business setting and someone is looking at you, the only thing you can think of is, damn, he's missing a tooth, you're probably not getting your point across. Anyways, if you're missing one, what are your options? Well, actually, you got a ton of them. The first one, if you have enough bone, and if you don't, we can generally build it, is to put a dental implant in. Now, a dental implant looks like this. This little gray guy here. In essence, it's an artificial root that we can put into the bone and build a crown on it. And these things work great, to tell you the truth. They're fairly pain-free to put in, and you don't have to involve any other teeth with replacing the one that's missing. Probably a little hard to see, but this is a crown built on an implant. Okay? So the implant's up in the bone, and then we can actually affix a crown to it. Another option is to have what's called the non-removable bridge. So if you're missing a number of teeth, say right here in front, you can shape the teeth on the sides down and have a bridge that is then cemented in, and it doesn't come out. They can look natural, they can look great, and it's not something you have to mess with taking in and out. Now, if you're not in a position to maybe go to this Cadillac type of dentistry, there are other options. You could have a removable partial denture where you can take, it does come in and out, but it's held in by your own teeth. And if you just need a quick fix, these things can generally be made up in as little as a couple of days for you. So if you have an accident or something occurs, you can really get fixed up and back to looking normal pretty darn quick. Now, there's one other option that's now available called Snap-on Smile. And this is a thin sheet of plastic that just goes over the entire arch. So if you're missing a number of teeth, or you're having some implants put in and you can't put the crown on them just yet because they got to knit with the bone, you can actually have one of these things fabricated where it just snaps over your existing teeth and you got a full complement of teeth again. Now, when you're missing stuff, it's just flat out distracting. Not as distracting as me without a shirt on, but pretty darn distracting. So if you are missing some teeth, you can actually go from this to this in a couple of visits. So if you have that distracting smile, if you know when you look in the mirror you're saying to yourself, damn, that man's missing a tooth, maybe you ought to think about putting something back in there. So if you have any questions, give me a caller. We'd love to get you in and talk about the various options and what's right for you. Thank you.